The vast majority of pediatric patients with liver disease do not need a liver transplant, and our goal is to avoid a liver transplant, actually. We have to spend a large amount of time talking to the families to really make sure they're educated about what is involved. When we feel like there's a kiddo that needs to be evaluated, we have pediatric liver transplant doctors board certified in transplant hepatology on our team.
I always think, if your child is my child, what to do. When the children with any liver issues come to the Cleveland Clinic Children, they do a full assessment with a whole team. And once we identify the serious issues that potentially need a liver transplantation or any kind of surgery, that's the point that transplant surgeon will be involved.
A pediatric liver transplant program at Cleveland Clinic Children's is an established program, and we are the largest volume and most experienced liver transplant program in Northeast Ohio. And they've developed over time a very robust multidisciplinary team of ancillary doctors and support staff to help in the care of those patients. There's infectious disease doctors, cardiologists, nephrologists, immunologists, hematology oncology doctors. We need psychological and social work expertise to help the families. So that's what a well-oiled, robust, large team is able to do. You're able to tap into a lot of subspecialists who have experience for decades taking care of kids like this.
When somebody needs a liver transplantation, the liver comes from either deceased person or a living person. So at the Cleveland Clinic, probably 60–70% of the transplants are from living donor. We don't want to see your child waiting for liver transplantation months and years. When we do a living donor liver transplantation, we can transplant anytime, meaning we can transplant your child before he or she becomes really ill. Because we do more living donor liver transplantation, the average waiting time for liver transplantation at the Cleveland Clinic is very short, so that your child doesn't need to suffer from the serious liver disease.
A program called Anonymous Liver Donation. We are the third largest program in the country for the use of anonymous donors for our pediatric patients, and we're very proud that we're one of the centers at the leading edge of that, where an unrelated donor is able to raise their hand, so to speak, and say, I would really like to investigate the possibility of donating a portion of my liver to help save a child's life.
We developed new technology, laparoscopic living donor surgery. We make a small incision on the abdomen and place the surgical instrument and dissect and cut the liver and take out with a very small incision on the bikini line. The liver can regenerate after you remove the portion of the liver. And very interestingly, when this piece of the liver is transplanted to someone else, this transplant liver also regenerates. The purpose of doing this is trying to decrease the burden on the living donor. Because going into the surgery and having a large incision, it's a big deal. And donating the liver is also a big deal. But if you can do this surgery with minimally invasive procedure and a very small scar, less pain, and also recovery time is much shorter, I think it's very beneficial.
When you turn someone's life around, it's just an amazing feeling inside. It's what I can see it means to the family.
We have skills, we have experience, and we've been very successful, and we have saved many children. That's a special moment.